Hey guys, Coach Royce here, and thanks for tuning in. This is my 5th installment on my video series on FAI, or femoral acetabular impingement. If you have not watched the first 4 videos in my series, please pause the video and go back and watch those now. If this is your first time tuning in with me, I'm still going to try and educate you along the way on what it is I'm talking about. So today the subject is how to reverse the casting or guarding of the injury of the pinchy hip. So here is a list of symptoms you can expect as soon as you feel a pinch in the front of your hip when you go down into a squat or anything involving hip flexion. You're going to feel a pinch in your hip. That pinch will become painful after a while, and then soon after that, because the rotator cuff is dysfunctional, the rotator cuff is what brings your hip into internal rotation, like so. This looks like external, but it's not, it's internal. Because you can no longer get into internal rotation, your adductors, or your groin, the muscles that bring your legs together, are going to overcompensate, and you're probably going to strain an adductor. I am convinced that this is 90% of the reason people strain adductors is because they have a dysfunctional rotator cuff of the hip. It's not even the adductor. Soon after that, your body will begin to shut these muscles off. It will shut off your adductors, it will shut off your hip flexors, your pelvis will tuck, your back will round, and you'll start to have back pain. Isn't that awesome? Then, of course, since you're not using these ranges of motion and a lot of these muscles are inhibited or shut off, you're going to lose range of motion. This is where you need to start to figure out what's going on and reverse it. But that's what we're going to learn today. How do you reverse these losses of ranges of motion, and how do you facilitate the muscles that are trying to shut off after you reverse the problem? Making sure I didn't miss anything. Was shortening, yes. So when you have a loss of range of motion, obviously if you're not utilizing full range of motion, the muscles are going to shorten and atrophy, and that's going to be expected from the side glute, the glute medius, the psoas, your deep ab muscle slash lower back, and your hamstrings, and of course your external rotators, because you're no longer utilizing internal rotation. All the muscles that rotate the hip out are all going to be short. Piriformis, I'm sure most of you are familiar with that. I'm going to use that as an example. I'm going to set these over here. Actually, this is what we're going to do today. Basically, I'm going to teach you guys 3 movements that you can do that will only take you about 5 minutes that will help you reverse the casting and help to heal the hip dysfunction that you have if it is in fact a dysfunctional rotator cuff. There are specific things that you need to stretch or mobilize, certain things that you need to facilitate or turn on because they're inhibited or shut off. Specifically, you're going to want to address the lateral quad. It's the outside of the quad. The lateral quad gets outrageously tight in an attempt to stabilize the knee. So you can do that with movement or foam rolling or stretching, but the exercises I'm going to show you today will do this. The adductors I mentioned already, those are going to be inhibited. You're going to need to stretch them and facilitate them. That's why they're in both columns. And the glute medius, the side glute, is going to be shut off and short. You need to work it and you need to stretch it. Finally, the psoas, a deep ab muscle. That's another subject for another day, but I'm still going to touch on it a little bit today. Basically, I mentioned your back rounds. The psoas, the deep abdominal muscles that attaches to the lumbar spine, it gets short. A lot of back pain comes from a dysfunctional psoas, which could be coming from a dysfunctional rotator cuff. And finally, all of your hip flexors need to be facilitated, because as you lose the ability to flex at the hip, they will all begin to shut down. So, let's begin. We are going to start with the rear foot elevated lunge that I showed you in the last video with 2 variations. Variation number 1, we're going to do what is referred to as a halo. If you're not familiar with a halo, it's a kettlebell movement. You hold the kettlebell upside down and you go around the back of the head, staying as tight as you can without moving your head, and it mobilizes your shoulders. This is important because the shoulders are very much related to what's going on in the abs, the psoas, the lower back, and the hips. You're going to perform a halo at the bottom of your rear foot elevated squat, but also we're going to attach a band to the back leg. Remember, you're losing internal rotation and you're losing hip flexion. So we're going to take you into hip extension to stretch you and internal rotation. This is going to feel very, very good. So I have a band right here. I'm going to try not to get tangled with my mic. Attach the band to the back leg, pulling you in to internal rotation. Aside from that, it's exactly the same movement as the last video. It's a rear foot elevated lunge. Here's my weight plate. Remember, you're going to stack the shoulders over the hips, square the hips up. You're going to keep from arching the back too much. And you're going to sink into that stretching discomfort. And then at the bottom, you're going to perform your halo. And you don't need very many of these, maybe 2 sets of 8. You can alternate directions of the halo if you like. Stretch, psoas. So it's a little bit difficult to explain what the halo is doing, but basically, in short, your body is not a bunch of car parts. It works together. It's very synergistic, and the muscles that are deep in the shoulder, like the pec minor, the pec, the intercostals, and the ribs, and the psoas are very, very closely related. I should make another video on this. I'll probably do that. So when you go into your halo and you're stretched into hip extension, it's going to stretch your psoas. Like I said, it's going to feel very good. Moving on. Windmill, another kettlebell movement. This movement is, in my opinion, the second best way to stretch the glute medius, but it does something very particular here. Again, you're losing internal rotation of the hip, and hip flexion, and a windmill takes you into internal rotation and hip flexion. All you need is a kettlebell. It doesn't even need to be heavy. I don't think you can see my feet in this video, but you're going to start basically in a shoulder width position, shoulder width stance. You're going to turn your toes away from the weight. Weight's on the right, toes on my left. You're going to soften your knees, and basically you're going to hip hinge as if not to go directly to the side and not to go directly back, but right in between. Get that kettlebell overhead, lock the elbow. This is your anchor. This is going to anchor you into the stretch. Don't be afraid to use a heavier bell. Soft knees. Again, my toes are angled away from the weight. And all I'm going to do is bring my arm down the inside of this front leg, right? And I'm going to push my hip to the side and back. And it's going to stretch the glute medius on my right side. And it's going to bring my thigh into internal rotation. It's going to facilitate adduction. Look up at the bell on the way down. There's no way to avoid it. Your hip is going into internal rotation, hip flexion, and it's going to stretch your glute medius. Feels amazing. If you've never done these before, I highly recommend this movement. Push into the side glute, push into the stretch. That's not bad considering my mobility. I hope you guys enjoyed that. So that's a kettlebell windmill. I didn't give you guys rep ranges, but I think I'm going to piggyback on the last video, which I think I said something like 2 sets of 8. That's pretty good. This is more of an intuitive thing. You're going to do this movement until you feel the muscle stretch, release, until you feel an improvement in your range of motion or mobility. So, rear foot elevated lunge with a band on the back leg and a halo at the bottom, kettlebell windmill, and finally, I'm going to need to take my shoes off for this one. I call this scissor hips, but it's a version of a stretch on the wall where you mobilize the hips. But for the sake of the video, let's call it scissor hips. This is going to help you tremendously to facilitate your adductors and stretch them all at once. But you can also manipulate the rotation of the hip in all positions, and I'll show you. Hopefully my mic will reach over here. We're going to give it a try. It's a little close, so I'm going to take it off. Apologies if this gets loud. This mic is a little crazy sometimes. We're going to set this right over here. Sit about a foot from the wall, toes straight, knees soft, and spine neutral. Pretty simple. You're going to open your hips as far as they'll go without rounding your back or arching your back. And you bring them back up. This is turning on your adductors in their fullest range of motion in hip flexion. Again, you can do a set of 8 here. Then we're going to add a little fun to it. You're going to turn both of your toes to the left. Now, if you're paying attention, you already know my right leg is in internal rotation and hip flexion here. You can do one better. You can actually activate your glute minimus from this position. So now you're stretching adductors, activating glute minimus. It's a win-win. Switch directions, other side. You can also turn both legs into internal rotation and hip flexion. Repetition is key here. If you're trying to facilitate the adductors, they are pretty stubborn, so I would recommend possibly 8 reps of every single variation you see here with a lot of intention behind it. Well, there you have it, guys. I think I did a pretty good job today of keeping this video a little shorter than the last ones. I hope you learned something. We learned rear foot elevated lunge with a halo and a band on the back leg. We learned a kettlebell windmill, and we learned scissor hips on the wall. You can quote me on that. I named that, scissor hips. If you have a dysfunctional rotator cuff, go back and watch all my videos and learn what it is, how to self-diagnose. If you don't necessarily have a problem in the hip and you just have a rotator cuff issue. Anyways, I hope that this video helps somebody out there, and I hope you guys enjoyed watching, and we'll see you next time.